We're still there. After conventional periodontal treatment, 86% of patients were positive for pathogenic organisms. Journal Clinical Periodontology. Supragingival plaque, that's a slam dunk, doesn't reduce total bacterial counts, nor would we expect it. The goal of periodontal therapy is to eliminate the bacterial etiology. Journal of Periodontology 2000. Antibiotics, oh no, I said it. You knew it was coming. Antibiotics may be prescribed based on microbiological testing. Microbiological tests is needed to verify the subgingival elimination of target pathogens, and the potential recurrence of the disease can be monitored by prompt repeated microbiologic testing. Ladies and gentlemen, you know now that these oral microbiomes that are over threshold translocate. Okay, they exist now elsewhere in the systemic microbiome systems. They're on the heart, they're in the gut, they're in the lung. Okay, they're there. Now I spent all this time and energy to root plane and scale and get your teeth clean and the roots smooth. I spent all that time with that, like I used to. And you're 62 years old, you have some concurrent diseases, your immune system is compromised, it ain't working like it used to work. But I got you really clean, and I feel really good about that. And I send you home. I send you home now with translocated microbiomes on the vasculature, the lungs, the gut, who will now leak back and reinfect you within 60 days. Why can't I get rid of what plagues you, even with periodontal maintenance that's meticulous? Because I've left stuff in other locations that is destined to come back where it really wants to be. If you take one thing away from all of this, make it that. The following outcomes were observed in the largest double-blind, randomized, placebo-controlled study of non-surgical therapy of chronic periodontitis. The adjunctive use of metronidazole, formerly, as Carol liked to say, Carol? At Flagyl, amoxicillin results in a greater reduction in levels of periodontal pathogens compared to SRP alone. With SRP alone, clinical pockets increase. Some patients move from low risk to high risk during the study. Okay, again, next week, we're going to dive deep into this. You're going to have a study on antibiotic stewardship you didn't know was coming. The train is going to hit you again if you dare show up. Evidence-based standard of care for treatment, mechanical debridement always will be the footing and foundation of what we do. Adjunctive use of specific antimicrobials and or laser therapy. Laser has a place and is used quite a bit in pathogen mitigation locally. We'll get into that next week. I'm going to just discuss it now. The adjunctive use of appropriate systemic antibiotics, the adjunctive use of antimicrobial home care. When you're done, when you're clean, you must do something every day that maybe you didn't do before, and it's cheap, it's effective,